Labels, sometimes they bring relief, a fleeting sense of clarity, or the comfort of not being alone. Other times they deepen confusion. Am I a lesbian, pansexual, bisexual? Why do I even need a label for that? Language matters, but we often use it like a cage, carving neat little boxes to simplify what is fundamentally complex and fluid, and in doing so, erase the nuance that makes us all human. I've been diagnosed with major depression, opioid use disorder, PTSD, and then treatment-resistant depression, panic attacks, and generalized anxiety disorder. Each label seemed to fit me perfectly, yet I never truly have gotten better. Methadone has saved my life. I wouldn't be alive if it wasn't for methadone. Benzos have helped me with panic attacks, but when your anxiety is so bad and you keep taking what you're prescribed every single day, you become dependent and intolerant, and they're just not as effective. Other medications completely failed, therapy plateaued. I learned to expect disappointment as the baseline. For 13 years, I carried those labels as truths etched in stone until one psychiatrist, my current psychiatrist, said, "I'm not sure you were diagnosed correctly." That cracked something open for me. It wasn't a great feeling because how could that be? These labels explained me, or that's what I've thought. Once doubt is planted, it's impossible to ignore. What if my depression and anxiety were symptoms of something much deeper, something misunderstood or misnamed? What if I'd been misdiagnosed all along? What if my life could have been better, and would it have been better if I was seen clearly from the very beginning? And then comes the bigger question. What if it's not just me? What if the suffering we so easily pathologize is actually a rational response to an irrational world? It's convenient for the system, for our pain to be classified as a disorder. That way, the burden remains with us. We are the broken ones, right? What if the actual truth is that our society is what's actually disordered? Fundamentally disordered, cruelty normalized, exploitation built into the foundation. If we all woke up to that, if we realized we are not the problem, the ones who benefit from our misery would panic. Because when people stop blaming themselves, they start organizing. And when people start organizing, they become dangerous. They start dismantling systems that profit from their pain. We need some good trouble around here. That's exactly what this world needs. If it's not us who are broken. Addiction or substance use disorder, SUD. It's one of the most deeply stigmatized conditions. Despite being widely accepted as a mental health issue, people are still criminally punished for a completely victimless crime. We say we understand addiction as a disorder, but punish users for coping, trying to cope. It wasn't always this way. There was a time when opioid use, even heroin, was not demonized. Morphine and heroin were commonly prescribed. Addiction was a medical problem, not a moral failure. The shift came with racialized and class-based moral panics. In the US, fear-mongering about Chinese immigrants and opium dens, black jazz musicians doing cocaine, and Mexican migrants using cannabis fueled early drug laws. These were not based on science. They were based on control and prejudice, preserving white, middle-class norms through law enforcement. Addiction became a symbol of moral decay and deviance, especially heroin. Much of the hatred toward people who use drugs comes from these racist, classist roots. And ironically, many who hate addicts don't even understand their own fucking hate. That stigma shaped policies. Poppy fields were burned, lengthy prison sentences were handed out, and in the US, heroin is uniquely framed as this evil compound. Yet pharmacologically, it's not very different from any of the other opioids. that are legally prescribed. You know, the opioids that are pushed by billion-dollar pharmaceutical companies. That's why Switzerland's model is so important. Since the 1990s, Switzerland has provided pharmaceutical-grade heroin in supervised medical programs. Heroin-assisted treatment, so HAT. This evidence-based approach reduces overdoses, disease transmission, crime, and public drug use. It challenges the idea that addiction must be met with punishment or abstinence, and shows that compassion saves lives. But in the United States, addiction remains criminalized. I wonder why. For-profit prisons. Prisoners don't need to be paid minimum wage. So yeah, it's not criminalized because it's just so harmful and they're really helping people by sending them to prison. The way addiction is treated mirrors other stigmatized identities. Homosexuality was a DSM-listed mental disorder until 1973. Women who expressed anger or autonomy or didn't want to get married are so often diagnosed with hysteria. The term was derived from the Greek hystera, meaning womb. Ancient beliefs held that the uterus wandered the body, causing symptoms, and psychiatry used hysteria as a tool to dismiss and control women's resistance and emotions. This was not just ignorance, it was a method to enforce gender oppression. Black, indigenous, disabled, queer, and other marginalized people have had their suffering medicalized, criminalized, or completely erased. This is no accident. It's how power protects itself by labeling difference as disorder. This history matters because it reveals how little psychiatry is truly objective. Much of our suffering results from social, political, and economic systems, not individual pathology. So when we talk about addiction or mental illness, we need to zoom out and look at the bigger picture. I'm a pretty big picture at the moment. I need to lose some weight, but we have to look at the bigger picture. What if the real sickness isn't in those just trying to survive, but in a society that criminalizes and punishes survival? Reframing addiction this way shifts the question we ask, from punishment to systemic change. Words like neurodivergent or mentally ill are often placeholders, ways to explain pain or difference. Diagnosis can bring relief, of course, sense of understanding after years and years of struggling to understand yourself and find the puzzle pieces and put them all together. But we live in a sick society where poverty, abuse, alienation, and grief are normalized, and reacting to them is pathologized. Why do we ask what's wrong with me instead of what happened to me? What caused these adaptations? What caused me to have these unhealthy coping mechanisms? Where does this come from? Because much of the time, these are just ways that someone would naturally respond to trauma, their trauma responses. Psychiatrist Thomas Szasz famously called mental illness a myth. And he also famously pissed a lot of other psychiatrists off. Not because suffering isn't real, but because we medicalize human experience to make it manageable and depoliticized. Calling something a disorder strips it of context and politics. Szasz argued that most mental illnesses lack objective biological markers, unlike cancer or an infection, and are metaphors for behaviors society finds undesirable. And if you look at history, there is truth to this. And I quote, "There is no such thing as mental illness. It's a metaphor for behaviors that society finds undesirable." Thomas Szasz, The Myth of Mental Illness, 1961. He saw psychiatry, especially involuntary treatment, as a tool of repression, to silence those who don't conform. And I quote again, "In the past, men created witches, now they create mental patients." Psychiatry became a secular religion when dissent is pathologized, not tolerated. Saz warned that psychiatric diagnoses reduce social or political distress to individual disorders, undermining civil liberties. And I quote, labeling a child as mentally ill is stigmatization, not diagnosis. He believed that people had the right to live as they are, even if others consider the way that they live irrational or chaotic, without state pathologizing. He also viewed drug addiction as a social habit, criticized the war on drugs, and favored legalization. He argued prohibition itself was the crime. And it was, and it still is. It's always important to add nuance to these sorts of conversations. Really, everything is nuanced. We live in the gray. Everything is so much more complicated than we make it out to be, but it's just more simple for us to put things into boxes and label them. And of course, it's great to have language, to put words to emotion, ideas. I'm going to talk about the criticisms of Saz. I do feel that he had a lot of really great ideas. But, critics say that he went too far, arguing all mental suffering is social invention. And I wouldn't say that all mental suffering is social invention. I do feel like a lot of our suffering is the result of this sick, twisted society that we have been conditioned to live in. Critics say that Saz went too far with his beliefs. Research shows biological correlates in mental illness, brain structure differences, genetics, neurotransmitter imbalances, but these markers cannot alone confirm psychiatric diagnoses. 2022 Nature Reviews Neuroscience article states, and I quote, "Despite decades of research, no single biological marker has been established for any major psychiatric disorder. Psychiatry has advanced so much, it's come so far, and it continues to evolve, terminology, diagnoses, but psychiatry is still a very young field that relies heavily on subjective behavioral assessments and cultural assumptions." This brings me back to my core point. The rise of mental health issues might not just be individual biology, but a symptom of a fundamentally sick society. We live in a world where exploitation is normalized, poverty and inequality are baked into the system, capitalism rewards disconnection, competition, and expects burnout. Trauma is widespread, especially among marginalized groups, and it's compounded by race, gender, class, and disability. Vulnerability is punished, and healing is commodified. Mental illness is not just something inside people, it's something happening to people. It's a predictable outcome of systems that prioritize profit over people, speed over care, isolation over connection. If you're Black, poor, trans, have survived violence, incarceration, your risk skyrockets. And this is not some mysterious brain disorder. This is generational trauma and systemic harm. Like I said earlier, homosexuality was pathologized until 1973. Women's emotions were dismissed as hysteria, which is a term rooted in misogyny. The psychiatric system has long reflected and reinforced the biases of its time. As author and physician Gabor Mate says, the question is not why the addiction, but why the pain. This applies to all so-called disorders. Why the panic? Why the despair? Why the dissociation? We must zoom out. I'm not wearing pants, so I'm not zooming out too far. What systems and histories create these patterns? These are things we have to think about, questions that we have to ask ourselves. Mental illness is often a reasonable adaptation to chronic social violence, capitalism, colonialism, white supremacy, patriarchy, and we're all born into vastly different circumstances. Some with privilege and care, others, unfortunately, into cycles of trauma and violence. Mental health cannot be understood apart from class, race, gender, disability, or culture. They cannot be separated. It all has to be understood as a whole. Everything needs to be taken into account. Sociologist C. Wright Mills said, and I quote, "Neither the life of an individual nor the history of a society can be understood without understanding both." Bruce Alexander's rat park experiment showed rats isolated in cages given morphine quickly became addicted, but rats in stimulating social environments with freedom used far less and actually chose that over the morphine. We are those rats. Our cages are poverty, precarity, discrimination, broken communities, endless competition, and digital alienation. Instead of fixing the cages or just removing the cages and throwing them away, society medicates the rats and calls it treatment. This isn't to say that psychiatry or medication is always harmful. Many find relief, including myself. There can be positive life changes when it comes to therapy and finding the right medication. Some people, medication doesn't work at all. But over-pathologizing suffering is a system of control, not liberation. Traits labeled disordered like autism, ADHD, BPD, CPTSD are often ways to navigate overwhelming environments. Instead of adapting society, the system demands that we adapt ourselves. It's easier to medicate a child than to change the classroom. It's easier to label someone oppositional than to examine why they resist authority. Medical thinkers like Sods and Frantz Fanon challenged psychiatry's role in oppression. Fanon, a psychiatrist, argued colonized people internalized violence that was then used to prove inferiority. Today, we still punish people for scars inflicted by society. So what can we do? We should resist reducing suffering to biology alone. Refuse to individualize what is collective. Stop asking what's wrong with me and start asking what's been done to me and others like me. The times are urgent. Let us slow down. Slow enough to listen, slow enough to look around, and refuse to listen to the story the system tells us in relation to pain and suffering, in relation to our pain and suffering. When you zoom out, I'm gonna stop doing that, I know it's cringy, but when you zoom out, labels like addict, lazy, crazy, or unstable aren't truths. They're reflections of a system that wants us to believe that it's our fault. The burden is ours to bear. So what if we stopped believing that? What if we called this what it is? What it is a political crisis disguised as a mental health epidemic. What if we organized not just to survive, but to build a world that doesn't make us sick for all of us? Something that's really bothered me too, and it really does a disservice to people who are genuinely struggling. I've seen, diagnoses being used as a sort of social currency over the last few years. Online, obviously, because that's where the views come in and the likes, the attention. Communities get built based on people literally pretending that they have symptoms that they don't have. Nobody will pretend they have IBS, though, from anxiety, because that's not cute. Neurotypical being thrown around as if it's an insult, like you're not one of the cool kids, you're neurotypical. It even gets thrown around by people who are self-diagnosing, and I understand that it's a privilege to be able to see somebody get the proper care that you need, the right diagnosis. It's just weird for people to act like they're boring or untraumatized, their life's easy. It's just fucking gross. Just another stupid fucking label, to be quite honest. I don't even know what neurotypical means at this point. Most people are traumatized. Most people are trying to cope with this fucking reality we've been saddled with. Not everybody gets a diagnosis. It doesn't make anyone's pain less real. I think that most people are not being seen clearly. Their suffering is not being seen clearly, and the roots of their suffering is not being seen clearly, and it's very unfortunate. I'm going in soon for a comprehensive psych evaluation. I already told you I have several diagnoses, but I wonder if I've been misdiagnosed. Maybe there's another box that I'm gonna fit into that changes the way that I receive help. Maybe it changes my life for the better. None of this is my fault, and none of it is your fault. You're not broken for struggling. You are reacting the only way you know how to. It is no measure of health to be well adjusted to a profoundly sick society. All of this to say that from a revolutionary standpoint, this matters. When we believe that we are the problem, we stop questioning the systems that have harmed us and continue to harm us. We internalize dysfunction, become patients, not protesters, quiet, not critical. And that's exactly what the powers that be want. Seek help, be vulnerable, find what helps, whether it's diagnosis that brings you some clarity, medication, therapy, community, but don't let a label or labels become your entire identity. Remember the context. Question why so many have suffered and continue to suffer. We have to fight for a better world for all of us. But in order to do that, we need to take care of ourselves first. Stop asking what's wrong with me and start asking what happened to all of us. What happened to me? What made me this way? What forced me to have to adapt in this way? Ask, how might a truly just society have changed the course of your life, my life, everyone's lives? And what will it take to dismantle what's killing us and build the world that we deserve together? Healing isn't just about finding the right label. It's also about changing the world that made us need one to begin with. All right, I'll see you guys in the next one.